In this video, we will show the recommended technique for inserting PDO threads. It is important that clinicians are familiar with the various design techniques. Through the consultation process, the patient has advised the type of lift he would like to achieve. Firstly, based on the clinician's design, mark the entry point and direction of the thread. This will help approximate the length of the thread. Secondly, clean the area with betadine. Thirdly, local anaesthetic is administered for the procedure. Inject a small amount of local anaesthetic at the entry point. Also, inject a small amount of local anaesthetic over the zygoma if that is the end zone. Take note that this area of skin is quite sensitive. Lastly, administer a line of anaesthetic along where the thread will be inserted. Now moving on to thread insertion. Firstly, insert the trocar. Next, insert the cannula with the bevel pointed downward. Push the cannula along a tunnel created by the assisting hand. Always remember to push the cannula away from the body and not towards the body for safety. The aim is to insert threads in the subdermal plane as superficially as possible. Stop once you have reached the target zone. Please note that there may be periodic resistance, especially on the lateral part of the face. This can be due to ligaments as well as scars. When pulling out the cannula, press against the end of the thread. This engages the thread and ensures that it stays in place. Lastly, cut the excessive thread. It is best to cut the threads only after all the threads have been inserted. Firstly, use one hand to press on the thread and gently pull. Next, further traction is performed by pulling the thread in the opposite direction. Once the thread is engaged, use a pair of curved iris scissors to cut the thread. Depress the thread at the insertion point and cut off the excess. The end of the thread should retract completely into the opening and no thread should be visible.